Your employer has authorized a very important medical test for you and your family. The simple mouth swab test will give your doctor the best tool in prescribing your medications. Until now, no one has ever been given the opportunity to take a simple mouth swab test and get a detailed report on how your current or future medications metabolize or don't metabolize according to your own unique DNA, enabling your provider to prescribe your medications with precision. Pharmacogenomics, or PGx for short, is the study of how our genes affect the way our bodies respond to medications. The PGx1 Plus test predicts effective drug treatment and dosing, the right drug, the right dose, the first time. A personalized approach to medication screening, prevention, and management. Finding the medication that works best for you shouldn't be a guessing game. Traditional medicine employs a trial and error approach, but pharmacogenomic testing offers specific guidance about medications that work best for you based on your DNA. A simple cheek swab can even reveal which medications may cause side effects or dangerous adverse reactions. Presently, medication is prescribed in a one-size-fits-all manner. One treatment plan may work well for a person while causing an adverse reaction in another. Adverse drug events is the fourth leading cause of death in the United States, resulting in over 100,000 deaths per year and causing our healthcare system over $136 billion annually. PGx testing is not associated with diagnosing illness or disease. It's not associated with genetic profiling, and it's not associated with over-the-counter genealogy-type genetic testing like 23andMe. And it's not associated with or focused on undermining so-called big pharma. We want you to take your medications, but we really want you to take the medications that are right for your DNA. PGx testing is a simple mouth swab genetic test that will give your doctor the best tool in prescribing your medications. It's a once-in-a-lifetime test, as your genetics never change, and it's for everyone from the young to the elderly. And it's instrumental in not only saving billions of dollars annually, but also saves lives. And it's 100% private between you and your healthcare provider. The goal is to take the PGx1 Plus test and have the results as a key part of your EMR, your electronic medical record, and to take your meds with total confidence and getting the best results. Adherence is really the key to the goal. PGx1 Plus tests 50 genes, 200 genetic variants, and over 300 commercial drugs. In this slide, you'll see that one size does not fit all. Everyone is either a poor metabolizer, intermediate metabolizer, an extensive metabolizer, or an ultra-rapid metabolizer of medications. Not medications across the board, but each medication, you are a different type of metabolizer. So that's why we test so many medications. So let's go through this slide here. So this is concentration and this is time. So you can see that for a poor metabolizer, the medicine enters the body. It does not do its work. It just enters the body and it really overacts, right? You know, you have too much in your system and it doesn't leave the system. It doesn't leave your body. It just keeps the next 4 hours you take another pill. It just keeps adding to it and adding to it. It's a very dangerous thing to be a poor metabolizer of, let's say, you know, an opiate or something like that. It can be very, very dangerous. And many medications. If you're an intermediate metabolizer, you're either going to get a lack of response or an increased risk of ADRs here. Because again, it enters the body, it doesn't do its work, it just is really too much. That one pill reacts differently, and it does not leave the body very fast. So then here is the primary, the one that your physician would be able to see the report, and I'll show you a sample report here in a second. It's a normal response expected. So it enters the body, it does the job, and it leaves the body. It metabolizes correctly. That medication will be the right medication, and that's for every situation that you have the test results for. And so let's say you're on blood pressure medicine. And let's say I see this quite often, either yourself or you might know others that are on maybe 3 or 4 to 5 different blood pressure medicines. And it's because in today's society, the physician uses different types of ACE inhibitors or blockers or things like that, because they react differently and they work differently in the body, is what your physician would say. But with the PGx1 Plus test results, he's going to be able to see what one pill will work the best to bring down your blood pressure. So you won't have to take 3 to 5 different types of blood pressure. Same thing with diabetes. I know many people that are on 2 or 3 different types of diabetic medicines. And that's because of the way that, for many years, how doctors prescribe medicine in a one-size-fits-all manner. Whereas with your test results, and you'll see here, this is a color-coded test result that you'll get and that your physician will get. It's a PGx1 Plus test brought to you by Admira Health Labs, and this is John Smith's. This particular test is for pain. John has some chronic pain, so it is color coded. In red, it's consider alternative. In the blue, it's increased dose, or purple is decreased dose. And again, what we were talking about before in the previous slide, normal response expected is in the green, and proceed with caution in yellow. So you can see that without the test results here, as the doctor without him being able to use this as a tool, let's say John goes in and he broke his wrist and he has some pain. And so the doctor would normally prescribe him, let's say, with some kind of codeine medication for pain. Well, in John's results of his PGx1 Plus test, it says consider alternative if no response, because he's probably, a non-metabolizer of these type of medications. So he goes back a week later, says, "Doc, it really still hurts very badly." Well, let's try to, either add, or he might go down the list, and all of those medications for that pain might be in that same listing for consider alternatives for John. And so you might give him oxycodone. Well, then he's got to go back again. Or the doc may say, well, let's take another x-ray, or let's do an ultrasound or an MRI, because I can't figure out why you're still in pain. So in other words, if he would have looked on his color coding for his PGx1 Plus results for John, he would have seen that with some of the medications, he could have gotten normal response expected from that medication. These two are for psych drugs. So this one here is for an anxiety disorder, or, simple depression or major depression. And so you can see that there are some reds here for some medications that John, that the doctor may consider for John's depression. There are some reds, or even purple, decreased dose by 25%. So it's very detailed. But really sticks out here is this folic acid. This is a vitamin, and it is in many things that we eat and drink. It's already infused in it, not just even as a supplement that we take. But for John, he should not take folic acid. That's very important to know. He might be going into the doctor, drinking down one of those power drinks, and it's actually infused with folic acid, and he doesn't know he's getting like 5,000 times the daily allowance of folic acid. So these reports are really very, very informative, because we also provide in the one test, in that one mouth swab test, it also includes drug to drug, drug to food, drug to alcohol, and drug to lab. So drug to drug interactions can result in adverse side effects, reduce effectiveness, or increases drug activity. Drug to food. Food consumption can affect the activity of some drugs, altering the efficacy. Drug to alcohol. Alcohol does interact with some medications and can lead to increased risk of illness, injury, or even death. And very important here for a lot of you that take a test for work, your random testing for work, some of the prescription medications that we take can actually show up as a false positive. So drug to lab results and laboratory test results can be false and misleading due to prescription drug use. So here is an example of a drug to drug for John. Drug to drug interactions where one or more drugs interferes with the pharmacokinetics or dynamics of another drug, affecting its metabolism, efficacy, or toxicity. These are very detailed. So in other words, John is on 2 different medications, or maybe he's on one medication and they're showing, hey, if you want to get him on this other one, it's a major concern. It's going to show exactly what this is very important. It's going to show the clinical management for that. Same thing here, this drug and this drug, it's a major concern. Now we also, like I said, test for the drug to food interactions. Certain foods can alter the pharmacokinetics of medications, disturbing the metabolism or efficacy of the drug. So a lot of times if we're taking, let's say, atorvastatin for cholesterol, we cannot have grapefruit. It says that, there's a moderate concern here in the yellow. Who would have thought that aspirin, you really shouldn't have celery when you're taking an aspirin regime. So, you can see that these also have, for John, some red here. Now, yours are going to be unique. In other words, also, if you are thinking, well, why would I have my children take the PGx+1 test? If I take certain medications, then they can take the same because they have my genetics. Well, everyone is very unique when it comes to prescription metabolizing of your prescriptions. So, in other words, your spouse and you had a child or children, and you guys shared DNA with this child. So, it is not the same. Your child cannot be expected to have the same results that you would. So you really would want to have your children tested as well. Because again, you'll want to have your children and yourself have the right drug the first time according to your own unique DNA. So PGx testing affects everything. Adherence is really important. So we can go through all of this. We can tell you how all of this works. Your doctor gets the results. He's going to utilize that. He's going to prescribe you the right medication to get the best results, the right medication for your DNA. And then you don't take your drugs, you don't take your prescriptions like you're supposed to, then you're not going to have the best results. So really, adherence provides the best results. It's less time off work. It's better job performance and productivity. It's less chances of adverse drug reactions or death. There's no second guessing. Provider and patient confidence, less chance of doctor or ER visits, protecting yourself and your children for a lifetime, less complications before, during, and after surgery, and so much more. Be a part of the solution. Say yes to PGx. Your employer has made an informed decision to provide this important benefit for you and your family. You may share this video with your family and others at propgx.info/training.html. After this training, you will be further instructed on how and where to take the PGx test and meet with your healthcare provider, who will discuss your results with you. Thank you for attending this very important training brought to you by PGx Incorporated and Admira Health Labs.